In a big relief to COVID patients, Kerala government has once again released an order to cap the treatment and bed charges in private hospitals. The order came out on May 10th. The decision in this regard was taken following the reports that private hospitals in Kerala were squeezing people for money in the name of COVID treatment. According to the order, the private hospitals that have a National Accreditation Board for Hospitals and Healthcare Providers, that is NABH in short, can charge Rs 2,910 per day for the general ward, and those without NABH can charge Rs 2,645 per day. For the High Dependency Unit, that is HDU in short, hospitals under non-NABH can charge Rs 3,795 and hospitals under NABH can charge Rs 4,175 per day. For ICU beds per day, hospitals under non-NABH can charge Rs 7,800 and those under NABH can charge Rs 8,580. Private hospitals under non-NABH are allowed to charge up to Rs 13,800 per day, and hospitals under NABH can charge Rs 15,180 per day for ICU with ventilators. Hospitals can also charge extra for investigative tests like CT chest or HRCT chest scans, as well as for PPE kits and costly medications like remdesivir and tocilizumab. Other than these, all other services are included in the above mentioned charges. Multiple rounds of discussions were held with the private hospital associations by the Principal Secretary, Health, State Health Agency and Director of Health Services. Based on the discussions, the rates to be charged by the private hospitals for treatment of COVID-19 were recommended, says the recent order. The order also says that the hospitals should be transparent in the rates and they need to display them. Services given to the public by each and every clinical establishment, including rates for the same, should be displayed in a visible and accessible place in the organization or on its website, the order says. The order further states that if any hospital is found to be charging more than the rates as indicated, they will be levied a penalty that will be 10 times the additional charges by the concerned DMO. There shall not be exorbitant pricing of COVID-related consumables like PPE, pulse oximeter, masks, portable oxygen cylinders and consumables, else action shall be initiated by the district collector against the concerned under relevant provisions of the law. No shops or hospitals shall charge more than MRP for these items, the order adds. Earlier in 2020 July, the government had released an order capping the charges for COVID-19 medical care, but that has not been followed by many hospitals in the second wave of the pandemic. On April 30th, the Kerala High Court directed the state government to take measures to cut costs of COVID treatment at private hospitals. News Desk, Kaumudy, English.